All right, on the phone right now, we have a couple of folks from Veterans Inc. right here in Worcester. It's Candace Runslow and Jeff Busby, and this is Recovery Awareness Month. And Veterans Inc. That's just one of the many things they do to help veterans out is recovery from addiction. And Jeff, what is going on this month? How is Veterans Inc. Handling Recovery Awareness Month?
Well, that's a good question, Mike. We do a lot because there's such a stigma on anyone that struggles with addiction, may it be alcohol abuse or substance abuse with drugs. And then veterans, have a lot of other stressors and traumas that come along with that. So to educate people, to kind of take the shame away, this month we are just really highlighting the fact that addiction is a disease of the mind where people need to get treatment and to receive some encouragement, help, and support, not only for those that wrestle with addiction, but their families as well. So we have many different events that are taking place this month just to heighten the awareness.
And here at Independence Hall, we are a clinical stabilization program that supports those things. So we do support treatment and addiction and mental health stabilization for 14 to 21 days on average. So I am the Women's Program Coordinator here at Independence Hall, and a little about Independence Hall is that we are in the heart of historic Shrewsbury, Massachusetts. And we're located on 22 acres of open fields and gardens. It's a nice oasis away from the city and away from things, the daily stressors that people encounter with addiction. So they're really able to go into retreat here. It's a first of its kind behavioral health treatment center focused on veterans recovery and those battling addiction, post-traumatic stress, mental illness, trauma. And so what they can get here is group counseling, individual counseling. We take place indoors and outdoors with those counseling groups.
Yeah, we kind of take a holistic approach, Mike, because people come from all walks of life, and so we have veterans here along with civilians. They need each other. We need to be able to say thank you to our veterans for serving our country. They need that support, and they usually bring structure. And then those that are here from other walks of life, civilians getting treatment, are able to show their appreciation to the veterans as well as learn from them about structure, because what ends up happening, veterans need support, civilians need structure. So it's kind of a nice means of treatment that we provide where they come together struggling with the same thing, addiction.
Some of the details about our facility that stand apart from other places is that each person who comes to us for treatment has their own individual bedroom and their own individual space.
And their individual treatment plan.
Yep, individual treatment plans.
Yeah.
We have personal trainers in yoga, CrossFit that comes every week. So we serve the mind, body, and spirit rather than just the clinical needs of the individuals who come with us to live with us for those 21 days. We have an activities coordinator who does sports. They go for hikes. They walk around our grounds with people. We have the art groups where we conduct art therapies every week, and we have a lot of collaborative art that's being created here with patients and even staff involved. There's a lot of interesting things that happen here. We have drumming circles, live performances, all these things that people can come in and take part in that aren't really part of other facilities in the state. So that's what really makes us one of a kind, is that we're treating the holistic nature of every individual who comes in. Even down to the food, we have volunteers who come in here for treatment who assist in preparing foods for the entire population. So they're gaining skills for vocation at the same time, learning how to, create nutrition plans with Chef Henry, and they're able to take those skills into the community and do something with that when they're finished here as well. So there's a lot of confidence building here. There's a lot of growth, and that's why our motto is.
This is where recovery grows.
That's where recovery grows.
I think I think it's great that there are so many options, because when I think of recovery, I think of sitting in like a kind of a sterile room in a circle with chairs and talking with each other, which is great if that's what you choose to do. But offering stuff like hiking, arts, culinary stuff, activities like that, I think it's great that there's a lot of options. Now, if there is a veteran listening and they think they need to seek help, how do they get involved with this?
So they can actually call us at our main line.
Also, we also have a website they can apply online at Independence Hall, Shrewsbury website, and our phone number is?
It's 1-800-482-2565, and they can also go to apply for Independence Hall, they can go to veteransinc.org and look for us under the Independence Hall tab. You can actually just give us a call here at Independence Hall, which is 508-845-6176, and you can ask to speak to the admissions department. We take referrals from other facilities like detoxes and hospitals where people are getting mental health stabilization, but we also do self-referrals. People, as long as they're medically cleared to be here and they don't have a high psychiatric need for a high level of care of inpatient treatment, they can come right to us as long as they're healthy and safe and they can take part in our programs. A lot of times people can take part of our programs even if they're at risk. They don't need to have used a substance. They can sometimes apply and come right in on the basis of a risk need. They may relapse or they may have trouble with that before it even happens. And that's something else that's also different about our facility, is that we take people in before the event happens so that we can prevent it.
One thing I like to just add to what Candace is sharing is the fact that people need a continuum of care. People tend to be chronic relapsers that we treat. And so sometimes they need a new psychological evaluation and medication evaluation to ascertain what kind of help do they need with their mental health symptoms. And then along with that, we also, along with the clinical treatment that they receive and our holistic approach, we do aftercare here. We keep them in the continuum of care. So when they're done here, they many times they step down to a RRS, it's a residential rehabilitation services, or a halfway house, and learn how to kind of integrate back into society with the support, while yet continuing to work on their refusal skills, refusing to pick up, to drink, and to drug again. And also there's family reunification that we do here, and bringing the family back together, educating family members about the disease and what they should and shouldn't do, and providing support that they need to their spouse or family member. So that continuum of care is a key component.
You guys have a recovery summit coming up. Can you tell us a little bit about that?
Sure. The Recovery Summit will be here at Independence Hall on September 20th. It's just coming up next week. And so we have various members of the VA, the community, providers, even the Sheriff's Department, other providers in the field of addiction medicine coming in to sort of meet together and network and share findings on what we've learned about addiction and recovery this past year. And that's such a valuable event because everybody who works in addiction medicine is together in the same room, face-to-face. And so when you make those face-to-face connections, I think we get a lot more out of what we do for our patients together as a collective. It solidifies the relationships that we have with each other provider, with other networks in the state. One thing that I learned last year was how much the Sheriff's Department could do for us regarding, the legal needs of our patients, even housing needs of our patients. They have so much to offer. We make so many great networking connections, and we get to share what we do here at Independence Hall with the community too. People get to come in and see what we are doing in real time, and they can get a grasp on what we can offer to help people lead healthier lives here.
Now, if people want to get involved in the summit, do they go also to veteransinc.org?
Yeah, I think you can go to veteransinc.org, and you can call the 800 number.
Yep. It's the number is 1-800-482-2565, and they could just ask for Marlene Kilcoyne. She can help get them involved in that.
So the value of the summit is we can be encouraged. You know, a lot of working professionals have secondary trauma from working in this field. You lose people that you've helped. And so we're able to learn from each other and support each other. Very important day here at Independence Hall for the working professional.
If people are seeking help and if people want to get involved in the Recovery Summit, they can go to veteransinc.org and get the information there. I really appreciate the work you guys do in helping our men and women who have served. And Candace Runslow and Jeff Busby, thank you. Thank you so much for taking the time today to let us know about that service and about the Recovery Summit coming up.
Well, thank you for the opportunity, Mike. Great sharing the information with you and all those that listen.
And thank you. Thank you very much for having us on today.